When I woke up, I was initially shocked and confused. I'd been injured all over, but felt pain predominantly on my left thigh. My initial questions upon regaining consciousness were, what about my family? Are they okay? Would we be treated at the same hospital? And on the way to the hospital, after having been treated for some pain, I asked the paramedic questions like, how long will it take us to be discharged? And whether or not we could afford the treatment. I desired for a smooth transition throughout the whole journey for my family too. I hope that the health professionals would be very informative, succinct, empathetic, and helpful towards my whole family, and expected the health professionals to be compliant with everyone's requests.
My role is a paramedic, who is the first of the healthcare team to attend to crash victim Cara Lovegrove. When I arrived at the scene, I thoroughly observed her injuries, which included a fractured midshaft femur. I quickly assessed her pain level at the time, and she responded with a 10 out of 10. According to this assessment, I had to treat her significant pain level by administering morphine, which allowed her to withstand the injury. Cara was then quickly transported via ambulance as she was expecting an efficient healthcare journey. During the transition, I addressed all of her concerns, specifically relating to the safety of her family, insurance, and the duration of her stay. Once we arrived at the hospital for admission, we performed a verbal handoff with Nurse Kehoe and his team. I made sure to clearly communicate the details of Cara's injuries to compete against a loud hospital setting. The health professionals would not have had sufficient time to read the written report, as they had to treat her swiftly.
As a medical imaging technician, I take images of the inside of a patient's body that may be injured or could harm the patient. Upon Cara's initial admittance to hospital, I took an x-ray of her lateral cervical spine, her pelvis, and her chest in the supine position to determine any immediate concerns needed to be treated in the emergency room or theatre. Before and during the x-ray, I explained to Cara the process and what it would do. This is to keep her calm and reassure her that we were taking care of her. The assessment of the images determined no life-threatening problems. Once Cara had been stabilized by the emergency team, I took her to have a CT scan of her head and neck and an anterior, posterior, and lateral view of her left and right femurs, tibias, and knees. Similar to the x-ray, I made sure she was comfortable, then explained the process, how long it might take, and addressed any questions or concerns Cara may have had. The images taken were delivered to the doctors, Nurse Kehoe, and any health professionals caring for Cara.
The nurse is charged with many tasks in relation to the care of a patient. I am with the patient from admission to discharge, all the while evaluating their physical, emotional, and psychological needs. I then develop a unique plan of care where I aid in the various aspects of care the patient may require. This includes administering a medication, alerting health professionals to any changes in the patient's condition, and helping a patient with illness prevention. In the case of Cara Lovegrove, I was present during the verbal handoff by the paramedic. Knowing that she had been given something for the pain, it was essential that I kept her calm and put her immediate worries to rest. I reassured her that her family were in good hands and that she would be able to see them soon. After the immediate surgery and during the recovery process, it was discovered that Cara had cancer. Thus, I administered a medication that Annie, the pharmacist, provided for her and explained what their purposes were. I also helped Cara readjust to the uncomfortable sensations in her feet as a result of chemotherapy, as recommended by John the podiatrist.
As a hospital pharmacist, apart from preparing and dispensing prescription medication, I provide patients with drug information and counseling and monitor their medication therapy. I work alongside Nurse Kehoe, and I am directly responsible for Cara's medication-related needs. Cara was prescribed with multiple drugs throughout her hospital journey, including antibiotics, paracetamol, opioids, and radioactive iodine. To avoid adverse drug interactions, I ensured that these drug combinations were safe, and as a result of close collaboration with the radiotherapist and podiatrist, Cara responded well to all prescribed medication. However, she did experience some severe skin reactions from the cancer treatment, so after consulting the radiotherapist, we recommended washing skin gently with water alone and applying lanolin-free hydrophilic cream, which have helped Cara's skin recover fully.
As a podiatrist, I assess and diagnose the foot and lower limbs of patients and apply therapeutic and surgical techniques for treatment and rehabilitation of the patients. I provide the patient with a clear and concise explanation of the procedures. I work with Nurse Kehoe for patient care and rehabilitation, and with hospital pharmacist Annie to ensure my drug combination is safe to prescribe. Since Cara underwent radiotherapy, her immune system became more vulnerable to infections, one of which was the ingrown toenails, causing both short and long-term damage. For initial treatment, full matrixectomy was performed to remove Cara's ingrown toenail. However, since the symptom is most likely to recur as a long-term side effect of radiotherapy, post-treatment medication was prescribed, including acetaminophen for pain control and sulfacetamide sodium as an antibiotic. Peripheral neuropathy was also caused due to chemotherapy, causing her hypersensitivity and pain in the feet. I provided her with exercise and massage that will aid in her recovery, which the nurse will help with. If the symptoms persist, however, I would discuss with the radiotherapist for the reduction in radiotherapy dosage.